Good afternoon, everyone. My name is Jill Gibson. I am the Chief Medical Officer at Planned Parenthood, Arizona. What an amazing day and such a wonderful experience to be surrounded by so many friends and advocates. I feel uplifted by your presence and support during this time in our country and our state, where providing basic, essential sexual and reproductive health care and abortion can feel incredibly isolating and overwhelming. Thank you for reminding me that we, all of us, are actually the majority and that we are truly in this together. Thank you. I'd like to take a moment now to recognize some of our frontline staff who have demonstrated incredible resolve and commitment to our mission through the many challenges of the last year and a half. Danae and Keisha, would you stand and be recognized? Danae and Keisha are our clinical abortion nurses. I have the pleasure of providing abortion with them every week, and I am constantly re-inspired by their care. Keisha provides a level of comfort and compassion that creates an environment of complete peace and safety for our patients. Danae is our air traffic controller. She literally keeps the clinic operating and exemplifies authentic and non-judgmental care. In addition to clinical nursing, Keisha serves as a patient navigator, bringing patients from all over the country to Arizona so that they can access basic health care. She also assists Arizonans who must seek abortion care outside of their communities due to our own state's egregious restrictions and bans. Keisha embodies the ethos that healthcare is for all, and her patients benefit greatly from her efforts to ensure that they are treated. And as if that weren't enough, in the past year, this duo also established an abortion doula program at Planned Parenthood, Arizona. Together, they trained and have coordinated 20 volunteers, many of whom are present today, to be present with our patients during their abortions, a service that has made a world of difference. Thank you, Keisha and Danae. You are invaluable. I also want to raise up my frontline health center staff who are present today. Will you all stand and be recognized, please? From our healthcare assistants, to our center managers, to our nurses, to our physicians. You all literally keep the doors of sexual and reproductive health care open. You all walk through the protesters and the noise and the sometimes very complex environment in which we operate to model care that is welcoming, caring, and genuine. I see you all advocating for your patients in ways big and small every day. This work is not easy. Thank you. And I'm going to say it again. This work is not easy. And the year and a half since the Dobbs decision has been particularly crushing because we who provide the care know firsthand the impact of abortion and the ramifications when access to this care is taken away. Here in Arizona, as part of the first appointment that starts the 24-hour waiting period before a patient can access an abortion, I sit with my patients to deliver the state-mandated physician abortion counseling. While I loathe having to read a 5-page script full of misleading and biased information, and I disagree with this medically unnecessary waiting period, I have grown to appreciate this one-on-one time with my patients. Though I never ask them the reason they need their abortion, so many of them volunteer their reasons and their stories. And I want to briefly help you all understand the many reasons that Planned Parenthood and abortion will always need to exist, despite politicians and judges' attempts to erase us, and how inhumane it is to force someone to continue a pregnancy that they have decided to terminate. During the counseling session, some of my patients cry. Some cry quietly, and so many of them apologize to me for their tears. Some sob and can't hardly contain their emotion. Many are surprised by their tears because they are certain of and confident in their decision. Pregnancy is full of big and complex emotions, regardless of how one determines to manage its outcome. I'm constantly impressed with how thoughtful my patients are when they're considering their pregnancy outcomes and options. And I see abortion as an option that many of my patients who are already mothers choose out of love for the family and children that they already have. They tell me that they don't have the financial or emotional or mental capacity to add to their families. I see some patients choose abortion, and it is the first time in their lives that they have made a decision that is truly for their own well-being. Some choose abortion because they are just about to deploy overseas, finish their trade school, or earn their degree. Some are in high school. They tell me that they didn't even want to have sex, didn't know they could get pregnant, that their partner said that they put on a condom. I hear my patients tell me that they need to end their pregnancies because the father of the pregnancy is emotionally, physically, and sexually abusive. Many of these patients recognize that having to raise a child with this partner would forever tether them to a toxic relationship. My patients tell me about their sexual assaults, their abuse, their trafficking. Sometimes they choose a medication termination rather than an in-clinic procedure because they are afraid of anything that would remind them of their assault. Many terminate pregnancies that result after perfect and correct use of contraception. And they ask me over and over again, unbelieving, but how can I be pregnant? For many, Plan B wasn't successful. For many more, contraception was never affordable in the first place. Some bring up their traumatic and dangerous past pregnancies, times when they felt powerless and vulnerable. I've had patients of color tell me that they don't feel safe staying pregnant and birthing because of the very real racism that still exists in our nation. Some patients are so sick with severe nausea and vomiting of pregnancy that they can't lift their head up off of my desk, vomit bag in hand. One told me she was suicidal at the prospect of remaining pregnant and that she knew she wouldn't survive if her pregnancy wasn't terminated. And some are terminating desperately wanted pregnancies that didn't form correctly. I've had patients with chronic illnesses who face potential mortality if they continue their pregnancies. Some of my patients are recovering from drug and alcohol abuse, and some are still actively using drugs and alcohol, and they tell me that they don't want to expose a fetus to the effects of their addiction. Some of my patients say that they need an abortion because they're homeless, and some because their parents will kick them out if their pregnancies are discovered. And many more of them sit silently and listen to the state-mandated script, and I'll never know any of the details of their lives or the circumstances that brought them into my clinic. And that is absolutely fine, because the whole point is that the patient herself is the expert on her life and what she needs. And if I've learned anything from this work that I wish I could share with everyone who wants to try and have a say in abortion, it is that we can trust girls and women and pregnant people to make the choices that are right for their own lives. And what we in this room recognize is that abortion bans and restrictions don't at all change the very real need and demand for abortion, but rather caused forced pregnancies, further existing health disparities, and propagate historic racial and gender inequities. And we refuse this future. And so it is up to us. We won't stop. We won't quit. We will restore a state that respects bodily autonomy, and we will do it via a ballot initiative.